My name is Mervyn Powell and I'm an independent financial advisor based in Geneva. I was first diagnosed with prostate cancer 18 months ago. At that point, I think it's fair to say I was pretty shocked. The reason I chose to come to the HUG, the Geneva Hospital, was really on the advice of friends of mine who said you need to go to a world-class teaching hospital to get this treated. And that's when I came across Dr. Isla and his team here.
This university hospital is the largest in Switzerland. It entails 25,000 operations per year. To address the complexity of prostate cancer, in 2014, Geneva University Hospital decided to establish a prostate cancer center. So in the center we have an emphasis on multidisciplinary care. Every patient situation is carefully studied by specialists, and then through a weekly meeting, all the specialists involved work on the situation and find the best solution for the patient. To have all the people at the same time on the focus of one patient is, I think, primarily important.
I was really happy to know that this center was going to be created, and I thought for patients was even better news, especially because this will allow us to have a better synchrony and in the treatment decisions, being able to give the best recommendations to our patients.
The main benefit for the patient and also for us is clearly to share our expertise at each time of the disease of the patients. And by this way, clearly we learn that maybe surgery could be useful in a situation in which we thought before it was not. And this is certainly with this exchange of ideas that it is now possible for the patients, but also for us.
So I think what is emerging now with prostate cancer and many other cancers is that all our three specialties are overlapping more and more. And so the benefit of a center is to find out about this overlapping, and then patients get tailored treatments. I think this is the basis. So we use first, for a diagnostic step, we use a new biopsy technique which involves three-dimension ultrasound associated with MRI. We fuse those images together, and this allows to reduce repetitive biopsies that we used to perform before that period. We have had now over 100 patients going through this improved procedure, and we've been the first team in Switzerland to set this up, actually. Well, to get the best possible service, of course, you need the best technology, first of all. So in terms of technology, we do have access to two Da Vinci robots of the latest generation. We have the SI for the moment, but the XI is coming soon. We have two dedicated surgeons, myself and another fellow, who are taking care of the patients. We're specialized in that surgery, and we've done over 500 of these operations now in the center.
Our department disposes of cutting-edge technology to treat prostate cancer, implementing the rapid arc technology. The Novalis TX radiosurgery system can deliver very precise radiotherapy to treat prostate cancer with a single rotation around the patient. With the GPS system Calypso that we have integrated in our TrueBeam accelerator, we can track the prostate movements during all the irradiation and to know exactly where the prostate is located during the treatment course.
Aside from the conventional therapeutic options, the Center of Prostate Cancer offers the possibility to the patients to participate in our clinical trials in our research unit of phase 1, phase 2 studies. And this is a specialized unit where there is one medical oncologist, 3 nurses, 1 secretary and 4 study coordinators, and all the staff is completely dedicated to the patient.
Prostate cancer is a very complex disease. It affects many aspects of man's health, not just his physical well-being, but also his mental, his psychological, his sexual well-being. And in order to take into account all of these aspects of the disease, we want several medical specialties to collaborate to take care of this patient. One of the strengths of our center, I think, is the collaboration with patient support groups. We want to offer our patients an easy access to these support groups that are often very little known. One of these organizations is PROSCA. It's a regional patient support group for prostate cancer patients, and also ESCA, which is an English-speaking cancer association. Being formally certified drives us in our work, not only by formally establishing a collaboration between the 29 different units and entities of this hospital, but also by covering several other aspects of the management of the patient and his disease. We chose the label of the DKG, which is the German Cancer Society, because it is a label that is specific for prostate cancer centers. It covers all aspects of the management of prostate cancer center. It is particularly strict. It has more than 100 different quality criteria. And we are very proud to be the first center that obtained this DKG label in Western Switzerland.
If I reflect back on how I felt at the diagnosis stage, I'm thrilled that 18 months on I can do all the things I could do in my pre-diagnostic stage, and although I wanted to believe that during the research and decision on treatment, it's nice that it's confirmed, and I feel entirely satisfied that I'm rid of this particular condition, and life continues as it had.